Al-walie kasangwan. I will discuss type of wound. A wound is a type of damage or breakage on the surface of the skin. The wound can be due to accident like burns, paper cuts, skin tears, or surgical, any underlying disease, or some other skin condition that may develop in the wound. For example, eczema, eczema or psoriasis. Psoriasis. Type of wound can be classified in several ways depending on the healing time and necessity to consult with wound care specialists depending on the severity of a particular wound. People are likely to suffer from different type of wounds throughout life while performing daily activities. Depending on the cause, site, and depth, a wound can be laid from simple to severe. On her, we have to explain the severe one. Here, we have to explain different type of wound. Number one, open or closed. Wound can be open or closed. Open wounds are the wounds with exposed underlying tissues and open to the outside environment. For example, penetrating wounds. On the other hand, closed wounds are the wounds that occur without any exposure to the underlying tissue and organs. Number two, acute or chronic. A wound can be classified as acute or chronic depending on the healing time. Acute wounds are those that heal without any complications in a predicted amount of time, while chronic wounds are those that take a relative long time to heal with some complication. Type of chronic wounds. A. Pressure injuries, also known as bead sore, pressure sores, or decubitus ulcer. These wounds can be caused when there is a pressure and shearing force on the skin. Number B. Diabetic ulcer. These ulcers generally occur on the feet and are result of changes to nerve and circulation in the body caused by diabetes. It is include neuropathic, ischemic, and neuroischemic. Number 3. Clean or containment wound can also be classified on the basic if they are clean or contaminated. Clean wounds are those that do not have any foreign material or debris inside, whereas container wounds or infected wounds are those that might have some dirt, bacteria, or other foreign markets. Number 4, internal or external. External. Wound can also be internal or external. Internal wound can be due impaired circulation, nervous system function, neuropathy, or medical illness, or decreased supply of blood, oxygen, or other nutrients, while the external wound can be due to an outside force or trauma caused by penetrating object or non-penetrating trauma. Number 5, non-penetrating wounds. These wounds are the result of blunt trauma of friction with other surface. It includes abrasion, lacerations, bruises, concussions. Number 6, penetrating wounds. They are the result of trauma and break through the full thickness of the skin. It includes stab wounds, cuts, surgical wounds. First aid for open wounds. Number 1, control bleeding. Number 2, wash your hand well. Number 3, rinse the wound. Number 4, dry the wound. Number 5, replace any flap if possible. 6, cover the wound. 7, seek help. And 8, manage pain. Type of shock. Number 1, Septic shock result from bacteria multiplying in the blood and releasing toxins. Common causes of this are pneumonia, urinary tract infection, skin infection, intra-abdominal infection, such as ruptured appendix and meningitis. Number 2, anaphylactic shock is a type of severe hypersensitivity or allergic reaction cause include allergy to insect, sting, medicine, or food. Number 3, cardiogenic shock happen when the heart is damaged and unable to supply sufficient blood to the body. This can be end result of heart attack or congestive heart failure. A hypovolemic shock is caused by severe blood and fluid loss, such as from traumatic bodily injury, which make the heart unable to pump enough blood to the body, or severe anemia, where there is not enough blood to carry oxygen through the body. Number 5, neurogenic shock is caused by spinal cord injury, usually as a result of a traumatic accident or injury. First aid for shock, call 911. Number 1, lay the person down if possible. Elevate the person feet about 12 inches unless head, neck, or back is injury or you suspect broken hip or leg bones. Do not raise the person's head. Turn the person on side if they are vomiting or bleeding from the mouth. Begin CPR if necessary. Number 2, begin CPR if necessary. If the person is not breathing or breathing seems dangerously weak. For a child, start CPR for a child. For an adult, start adult CPR. Number 3, treat obvious injuries. Number 4, keep person warm and comfortable. Loosen restrictive clothing, cover with a coat or blanket, keep the person still, do not the person unless they are in danger. Reassure the person and do not give anything to eat or drink. Number 5, follow up. At the hospital, the person will be given oxygen and intravenous fluids, blood test, urine test, heart test, and x-rays and CT scans may be done. Other treatment will be on the cause of shock. Animal bites. The following type of bites pose the greatest risk of infection and should be promptly evaluated. Dog bites, cat bites, and wild animal bites. If you're bitten, you should immediately visit your doctor. Several reasons. There may be a risk of getting an infection including bacteria and rabies infection. Broken animal teeth embed in your wound. Foreign object embed in your wound also. And possible nerve and blood vessel damage. First aid for snake bites. Call 911 if there is any chance that the snake is venomous. The person has difficult breathing and there is loss of consciousness. If you know the snake is not venomous, treat as a puncture wound. Note. Number 1, note the snake's appearance. Be ready to describe the snake to emergency staff. Number 2, protect the person while waiting for medical help. Move the person beyond striking distance of the snake. Have the person lie down with wound below the heart. Keep the person calm and at rest remaining as still as possible to keep venom from spreading. Cover the wound with loose, sterile bandage. Remove any jewelry from the area that was bitten. Remove shoes if the leg or foot was bitten. Do not c- do not cut a bite. Do not cut a bite wound. Do not attempt to suck out venom. Do not apply tourniquet, ice or water, and do not give the person alcohol or caffeinated drinks or any other medication. Number 3, follow up. If you treat the bit at home, contact a health provider. At the hospital, treatment will depend on the type of snake. If the snake was venomous, the person will be given anti-venom treatment. A tetanus shot may be begin depending on the date of the last injection. First aid for dog bites. Number 1 was the one with soap and warm water. Number 2, gentle press and clean clothes over the wound to stop the flow of blood. Number 3, apply an antibacterial ointment to the wound. Cover with sterilized bandage. 5, watch for sign of infection. And 6, seek help if you suspect infection or possible exposure to rabies if the wound is severed. Thank you. That's all.